Happy New Year! I'm Commander Lori Christensen, the Public Health Emergency Officer for Naval Medical Center San Diego. This year's flu season is off to a busy start with a large spike of cases being seen earlier than usual. This is also a busy time for the common cold. So how do you know the difference? According to the CDC, the biggest difference is that flu symptoms usually start suddenly and can include fever for some, chills, muscle or body aches, fatigue, headaches, cough, sore throat, and a runny or stuffy nose. Cold symptoms start more gradually and rarely include fever, chills, or aches. A comparison chart is available on the CDC website. Flu is most contagious in the first 3 to 4 days after illness begins and is spread throughout tiny droplets that people make when they cough, sneeze, or talk. The first and most important step in preventing flu is to get vaccinated each year. In addition to getting vaccinated, you should stay home if you are sick, avoid contact with sick people, avoid shaking hands, sharing food or drinks, or kissing if you or others are sick. Also, wash your hands often, avoid touching eyes, nose, and mouth, and clean commonly touched surfaces with a bleach-based cleaner. Most people who get the flu will recover in less than 2 weeks and can self-treat with over-the-counter medications. Tamiflu is a treatment that is most effective when administered within 48 hours of symptom onset and is typically reserved for individuals in high-risk groups for developing flu-related complications. This group includes children younger than 5, especially under 2, adults over 65, pregnant women, and women up to 2 weeks postpartum, residents of long-term care facilities, and people with certain chronic medical conditions such as asthma, heart disease, chronic lung disease, and blood disorders. If you think you or your loved ones have the flu, the best thing you can do is stay home and rest and drink plenty of fluids. However, if you notice or experience any of the following symptoms for flu complications, seek medical attention immediately. These symptoms include difficulty breathing, inability to keep fluids down, a fever with a rash in children, or flu-like symptoms that improve but then return with fever and worse cough, severe or persistent vomiting, sudden dizziness, and pain or pressure in the chest or abdomen. For more information on flu, you can visit the CDC website at www.cdc.gov/flu. For information on vaccine availability at Naval Medical Center San Diego, call our flu hotline at 619-532-5358. Thank you. It is not too late to get vaccinated, and please remember to wash your hands.